Before I get started, I just have to give a disclaimer that all of my information is for educational and informational purposes. It is not to be taken as a substitute for actually visiting a doctor, an oral health provider, and getting proper treatment from a professional. We are continuing our conversation about women's oral health, and today we're going to talk about the oral mucosa. Okay, we're going to talk about what it is, what we see inside the oral cavity, conditions of the oral mucosa, symptoms that we may see in our mouth, and we're also going to talk about how they're linked to women's oral health. The oral mucosa is everything essentially from the skin of the lips, in the mouth, and really down to the throat, what we call the pharynx area. That's the lining of the cheeks, the tongue, the top of the tongue, which is called the dorsal surface, the bottom of the tongue, which is called the ventral surface, the floor of the mouth, the taste buds, the salivary glands, our hard palate, as well as our soft palate. The palate is hard in front, and as we get back to our throat, it becomes soft. The gingiva, so the gums that we see that are attached to the bone that is supporting our teeth, as well as that loose gingiva that travels into the corridor, the mucosa area. All these tissues are wet, they're moist, they have elastic properties, they flex. Some parts are fixed, but the tissue is very special. It is epithelium lining, has connective tissue, it has a lot of histological properties that you could explore. But today we're going to talk about the symptoms, like the clinical symptoms of what we see. Our salivary glands are what create that moisture. Our saliva is really important. And in health, saliva is abundant. It's always there. It helps us break down food. And when it's absent or when it decreases, we, of course, can have problems. And many conditions of the mouth are connected to salivation. And salivary flow, as we've talked about in many of these weeks, is connected to hormones. So we're talking about women's health, our oral mucosa, and symptoms and clinical findings that are connected to our health as women. And this is in early years with puberty, as we discussed in menstruation and oral health. Throughout our menstrual cycle, our salivary flow may be more abundant than other parts of our cycle. And as we age, perimenopause, postmenopausal women will have higher prevalence of dry mouth. Sometimes dry mouth is autoimmune. It could be Sjogren's syndrome. It could be connected to a disorder that actually impacts our glands that secrete tears as well as saliva. Or it could also be mood and stress. It could be connected to medications like asthma medications. So it's important to look at environment as well as our overall health. And that's why I have to advocate to have oral health visits that are routine every 3 to 6 months as necessary, and also visits with your other healthcare providers to talk about symptoms that may be in the mouth and also could just be connected to other conditions in your body. For example, Lichen Planus is a condition. It's an inflammatory response, and we see it manifest in the mouth. We may see white patchy lesions. We may see like a lace pattern of lesions on the inner cheek. It might be towards the bottom, the cheek where it kind of connects to the gum. And sometimes they look normal. It looks normal because the reality is when you look in the mouth, when you look in the oral mucosa, you're going to see a variety of patterns. You're going to see salmon pink colored gingiva. You may see white patches that are, Fordyce spots that are actually sebaceous glands, sweat glands in our mouth that are just a little bit enlarged. You may see our parotid gland entrance that has a little, whiteness to it. You may also see, collections of plaque. Sometimes plaque is white and creamy and can be mistaken for something. But what's important is that you pay attention to your symptoms and have routine visits, because we're going to look for all these things at your visits, and we want to keep that communication open with you because some things are normal and some things are not. Now, let's talk about another symptom of the mouth. It would be redness. So some things appear red, like when we have gingivitis, when your gums are inflamed, then they're more red than salmon or pink colored. And that should be alarming. And that means that the blood cells want to heal. There's a problem and your immune system wants to correct it. So redness around the gums is one thing. However, severe collections of red, your whole palate is inflamed red, that's more alarming. That could be something connected to a fungal infection, an imbalance of yeast in your mouth, Candida albicans. Your dentist may talk to you about perhaps stress or your immune system. Again, we want to think about our salivary flow. Saliva neutralizes things and it helps us rinse away debris and bacteria. While our mouth is full of microorganisms, it's full of bacteria, fungi, viruses, and cells, our saliva keeps things at a nice balance. And so whenever you have that imbalance, you can have a manifestation of conditions in the mouth. One thing I want to talk about right away is burning mouth syndrome. So burning mouth syndrome it's not very common. However, it does disproportionately affect women. And just as wild as the name is, burning mouth syndrome, is exactly what it is. It's kind of like the merry-go-round of life. We're not quite sure what causes it. It's connected to a variety of symptoms. It's connected to dry mouth. It's connected to vitamin deficiency. It's connected to diet. It's connected to stress. But what we want to do is try to figure out, like, if it actually is burning mouth syndrome or if it could be something else. And so it's important to think about burning mouth syndrome as neuropathy. It's a peripheral neuropathy because in our mouth, we have sensory glands. We have all these sensations: pain, taste, and texture. So when we think about our mouth, when something hurts, if we have a toothache, it's like the end of the world, right? So it's almost like the equivalent of cutting off your thumb. It hurts. It's painful. As we age, our taste, we have disturbed taste because there are not as many taste buds. And that's just a part of living, right? So as we age and our cells change, we slough them away, but we don't replace them as often. And this affects women earlier than men. They say women on average between 40 and 50 will see a decrease in taste. So first it's sweet and salty and then bitter and sour. Men, it's a little later. They don't have sensitivities to taste until around 50, 60. So this is something that is distinguished in women, female patients. They may notice disturbances in taste, and disturbances in taste is connected to burning mouth syndrome. So it's our taste, it's pain. You may feel like serious, like burning pain, and you're not sure what it's from. And that is because our face is it's innervated. It has so many cranial nerves, nerve endings, and everything is very sensitive. The other symptom of burning mouth syndrome is texture. And so texture is connected to saliva or lack thereof. When we have saliva running through the mouth, we don't even think about things. They're just so smoothly being rinsed away. We chew food, swallow, we go about our day. But when our salivary level is low, things taste funny. You may feel like there's a buildup of plaque. You may not rinse food away. You may feel like a cotton sensation in your mouth, almost like somebody is like scratching your tongue. And so I have had patients who will say, well, things feel like they itch in my mouth. And that's a very weird description for something in the mouth, but that makes us really think about salivary flow. The other thing that I wanted to talk about is that our salivary flow is connected to our hormones, particularly estrogen. And women throughout their lives go through fluctuations in hormones, but as we approach menopause in our perimenopausal years, our estrogen decreases. This is just the math of being a woman. And so as our estrogen decreases, we produce less saliva. And so with that, we are more likely to have dry mouth. And as I mentioned, saliva is a neutralizer. It's a part of our immune system, our immune response. And so when we don't have as much saliva, we're more sensitive to things. We may be hypersensitive to ingredients in food products, ingredients in toothpaste, mouth rinses, and also affects our immune system because we're not breaking down food as properly. So in our video on the gut, we talked about the enzymes that are available in our saliva that help us break down food so that our GI system gets the benefits. And so with that dry mouth, we can see manifestations that are not just in our oral health, but also our general health. And so women, as our salivary levels change, as we have a decrease in taste sensation, we want to see that connection, in our overall health. The other thing I want to talk about is medications that can be taken throughout life. And this is across population, but if you're taking medications for depression, asthma, medications that may be helping you to supplement other parts of your health, you may notice dry mouth from those medications. So it's important to talk to us, your dental providers, about your medications, because if it's something that we can change through our pharmaceutical needs, then it's important to do so. However, sometimes, like Lichen Planus, we don't know really what causes it. It could be vitamin deficiency. It could be connected to medication. And so we're always trying to figure out, like, what is it? Is it a tweak on this, a tweak on that? And that's why it's really important for us to talk about the whole cocktail of everything going on. Like I said, women's health is, it's like a merry-go-round. We are constantly changing through our hormonal levels. We're also going through periods of our life that affect our mood. Some doctors have described cognitive therapy in benefiting burning mouth syndrome, like, doing something that causes joy, maybe crocheting or spending time with your family and friends, writing, your certain pastimes that cause more happiness can actually decrease the sensations associated with burning mouth syndrome. So this is why this is just another conversation about women's oral health and the oral mucosa, what we should see and what stands out that needs to be examined by the dentist. We talked about the bones a couple weeks ago, and it's just the reality that as we age, our bone resorbs. And so in the mouth, our gingiva will change. In the absence of teeth, for example, the bone resorbs and the gums become loose. So you may see more creasing in the corners of your mouth as the dimension of your bite, shrinks, because you don't have that muscular and bone support to keep your mouth at a certain dimension. So you're going to see, creases. And of course, if as women, our bones resorb at a different rate than men. And that's something that is connected to us as women. The other thing I wanted to talk about was shiny gingiva. With lower levels of estrogen, our gingiva, our soft tissue is thinner. And so it doesn't have that fat, to it that we're going to see like in most of our oral mucosa. It doesn't have that fat so much, and it doesn't produce as much. And so our gingiva is actually thinner. That's what makes it appear a little shinier. The bone shines through a little differently with the reflection of light. So we talked about saliva, we talked about bone, medications, and what is healthy and what is not in the mouth. So thanks so much for tuning in on this conversation about women's oral health and the oral mucosa. We'll see you guys next time. Bye.